Hi everybody, welcome to today's video to support anybody who has an emergency nurse interview coming up. This video includes lots of tips to help signpost key areas to research before your interview and some example questions to prepare for. So I hope it helps and I wish you every success in your interview. So I'm going to start by signposting some key background research you can do prior to your interview to help you prepare for those questions, and I'll talk through some example questions as well. So firstly, double check what type of interview you have been invited to. Is it a face-to-face interview with a panel of interviewers, or is it a value-based interview, which is currently very popular in the United Kingdom? And I'll talk about a value-based interview later in this video. Or you might need to present a topic as part of an interview or answer questions as part of a paper exercise. The invitation you're given will state what type of interview you should be having. In a leadership position, for example, you're more likely to be asked to prepare a presentation than for a junior role. Next, you should systematically review the job description to understand the key responsibilities in the role and what is expected in this service. For example, is the role an accident and emergency department role in a large NHS trust? Part of your role would be to triage patients and to clinically assess patients. So it's helpful to read around the recommended triage tools, for example. In the United Kingdom, we also have urgent treatment centres, minor injury units and walk-in centres. If it's a leadership role, you might see audits and service evaluations described in the job description. Or you might see terms such as transformational or compassionate or relationship-based leadership. So it's helpful to review those key terms so that you understand them prior to interview in case you're asked a question about them. It's also helpful to book an informal visit to walk around the service and to talk to people in the role. You request an informal visit by emailing the recruitment lead or the manager in the department. And during an informal visit, you've got an opportunity to ask questions about the service. How does this emergency department run? What are the current challenges? And that will give you increasing insights, which again can help inform answers at interview. Not everybody can secure an informal visit though, and managers are very busy, but you might be able to book a phone call or a virtual call. A good tip is to try and book an informal visit as early as possible, so as soon as the post is advertised, for example. Also check out the employer website and their values and mission statement, because you might be asked a question on how your values align to the employer. If you have applied for a more senior nursing role in a UK emergency department, then you might have to do a presentation as part of the interview. Never neglect this part of the interview and do it all the night before. This could be the difference between securing a role or not, so it's important to prepare if you're asked to do a presentation for a nursing interview. So I've got lots of tips in my video which is free on my YouTube channel to help you prepare a presentation. So do check it out if you've got a presentation. An important part of your background research for interview is revising key healthcare terms and definitions and local and national standards, regulations, policies, frameworks or guidance related to emergency care that might come up at interview. So it's very difficult to answer a question if you're not quite sure of a term being used. So very helpful to revise these terms. So for example, if you're applying for a role that involves audits, then you could be asked what is an audit? What is an audit cycle? Or how do we learn from an audit? And it's very easy to go blank in an interview. You could be asked what is evidence-based practice? What is your leadership style? So it's very helpful to review key terms and definitions, go through your job description, but also any key terms linked to emergency care and that role that you've applied for. When you're reviewing national standards targets, in A&E departments and emergency care. Look at areas such as A&E waiting times or trolley waits and the time it takes to triage a person. And I'll signpost some key resources and websites on the next few slides. Also, key nursing policies, procedures linked to emergency care, health and safety, escalation and care pathways. So for example, the latest sepsis pathway, NICE guidelines for head injuries, and there'll be other generic areas linked to escalation pathways. Mental capacity assessment is very important for emergency department nurses to be familiar with, because registered nurses assess if a person has capacity to make a decision at that specific time, to consent to an investigation or to a treatment, or they could be walking out of the door and saying they want to self-discharge. So being able to understand what mental capacity assessment is to safeguard that person and make sure that they're safe to self-discharge, for example, is very important. Also review current topic areas and linked to emergency care. You could be asked, what are you interested in? What is the most recent paper that you've read linked to emergency care, or the most recent research study? So for example, I found a recent study examining the impact of delays in A&E as long delays cause avoidable deaths. So in 2024, there was a 25% rise in patients waiting 12 hours or more to be admitted to hospital from accident and emergency in the UK. This talk's being done in February 2025. So whenever you watch this video, have a look at what some of the key stats or key papers in this area. A few helpful UK resources and websites I've written here, but be aware that they may change or be updated in the future. But it's very helpful to start with the NHS department websites. They've got lots of resources, for example, NHS England, NHS Wales, NHS Scotland and Health and Social Care Northern Ireland. These sites will have major incident policies and all the current targets for accident and emergency departments, urgent treatment centres, for example, waiting times that are updated according to NHS pressures. We also have Government Department of Health websites, gov.uk, for example, where you find information on the Mental Capacity Act, mental capacity assessment, which is very important to revise before interview if you have a scenario-based question linked to a person's capacity. Read around patient group directives too. They allow patients, registered nurses, to administer specific prescription-owned medicines to a predefined group of patients without needing the prescription from the doctor. So you'll sometimes see patient group directives mentioned actually on a job description. Up-to-date legislation and standards will be on these websites. Also have a look at the National Institute for Health and Social Care NICE guidelines, standards and recommendations, such as NHS sepsis pathway, head injury assessment and early management. You can't be expected to know every single guideline, but having a look at some, because you could be asked where would you get your evidence from, for example, and a few typical ones. I found two open access current papers, the King's Fund entitled Accident and Emergency Waiting Times, and the Nuffield Trust paper entitled Accident and Emergency Waiting Times that you can Google. So have a look at what websites and resources there are out there. So I've written down a few current emergency care targets, but these standards and targets change. So always check what's currently up to date. This video is being released February 2025, but these are the sorts of areas, targets that you need to be looking at prior to your interview. So currently in England, A&E departments, the aim is for a minimum of 78% of patients to be seen within 4 hours by March 2025. And that is from the Handbook of the NHS Constitution, Department of Health and Social Care 2025. So this standard measures the total time patients spend in A&E from when they arrive to when they leave the department to be admitted, transferred or discharged. Now previously it was 90% 95% of patients to be seen within 4 hours. But this target was lowered due to ongoing pressure on the NHS, and it was lowered down to 78%. So this is an important target to look at because there's been an association found between delays to patient admission from emergency departments and mortality risk, which significantly increases after 5 hours. NHS England and other NHS departments across the nations track performance and the waiting times, and you can find that data on the NHS website. Another important area to research is the 12-hour trolley wait that we call it that in England, in the UK. This is a red flag and is sometimes called a corridor wait or a trolley wait, and you'll see this regularly being this 12-hour wait being reported in news outlets if there's excessive trolley waits. You'll see it on telly and on media outlets. Long delays and 12-hour trolley waits and above are associated with avoidable death, so that's why it's reported on. In 2024, there was a 25% increase in patients waiting 12 hours or more to be admitted to hospitals from accident and emergency. Corridor waits are also sometimes described in terms of decision to admit being exceeded by 12 hours, where a patient waits for 12 hours or more after a medical profession has made a decision to admit the patient to a hospital ward. So you'll see all these different terms being used in papers. But the time between decision to admit and the actual admission to a bed on a ward exceeds 12 hours is really important to report because it's a red flag again. So have a look at those stats because you might be asked about what you've read lately in emergency care, or you might bring them into an answer in one of your questions at interview. There are also different types of emergency departments in the UK with different targets being set. For example, we've got type 1 areas, which are the traditional accident and emergency departments. Then we have type 2 for specific conditions such as eye or dental emergencies. And then a third type that treat minor illnesses and injuries such as cuts, sprains, infections and rashes. And it depends on your role as to which targets link and what service you're applying for. But I would read around all of the departments as well, as you might refer someone from a walk-in centre to an accident and emergency department. So they work together to provide emergency care across the UK. And if you're an internationally educated nurse, it's also helpful to know about these different services and how they support and integrate together. According to NHS England, NHS operating planning and contracting guidance, urgent community response providers need to ensure consistency of service to reach at least 70% of patients referred to them within 2 hours. We also have ambulance handover delays that can indicate an increased pressure in the NHS. National guidance from NHS England currently states that patients arriving by ambulance at accident and emergency departments must be handed over to A&E staff within 15 minutes. But note that these targets can be updated and changed according to NHS pressures at any time. So during COVID, we had different targets set, for example, but the principle is the same. Always check what the current related standards or targets are linked to emergency care for the role that you're applying for, and at the time double check those targets because, as I said, they can change. When applying for any emergency care role, it's important to know how nurses triage patients. What are the current scales? Currently, we've got 5 levels of priority across the UK, ranging from immediate assessment to non-urgent, such as the Manchester triage scale. We also may use different tools in community settings or for a telephone triage or during a major incident triage. So review what is currently available because in the future we might not use the Manchester triage scale, it may be a different tool. UK emergency units tend to use the Manchester triage system. We've also got a Manchester triage system website, and it's one of the most common triage scales used across Europe currently. However, as I said, this might change. We have NHS major incident triage tools. NHS responders use this tool to rapidly categorise patients during a major incident. The most common triage system I know in the United States currently is START, which is a simple triage and rapid treatment triage system, but again, that might change in the future. So I've given you a few areas to look at current standards, but these don't just look at these areas. It's dependent on your role, as I said. Principles are the same, looking at key terms, looking at key standards, and looking at key areas within the role that you're applying for. Just to make you aware that I've got lots of free videos on my YouTube channel relating to quality improvement, leadership, risk management, and many of these videos give key terms relating to that area. So they give you a really helpful overview of clinical governance, for example, or a simple overview of clinical audit, the different types of audit, how you learn from audits, service evaluation, nurse education, developing leadership skills in nursing, and I also go through the different types of leadership styles in that video. So they're helpful for preparing for interviews if these aspects of nursing underpin the role that you're going for in emergency care. All free, so do check them out on my YouTube channel. I mentioned value-based interviews earlier. So what is a value-based interview? A value-based interview aims to select interviewees who align most closely to the values required in the role. So you will usually ask one key question that aligns to a value. So for example, the value might be compassionate care. So a value-based interview question might be, talk me through an example where you've provided compassionate care in a previous role or placement. And then the interview, when you give that example, the interviewer then will ask you more specific examples about the questions about the scenario that you've given and the description that you've given. So they start to drill down on details relating to that specific example that you're going to need to recall at interview. A few simple value-based interview tips. Value-based interview, the example that you bring to that interview should relate to you and the impact you made. Some of the details might involve other people, but the interviewer wants to know about you and that you align to this value. So it's not about you talking about somebody else providing compassionate care or leadership or quality care. It's about you providing compassionate care. And another classic mistake people make is they talk generally. So they might say, well, I always provide compassionate care. For example, I always do A, B, C, D across a service. When they want an example, they usually want one specific description of where you've made an impact or difference in that situation. And so, for example, you acknowledged other people's perspectives. It was you that was able to problem solve. It depends on the value and the question that you're being asked about. So key tip, don't just talk generically about a general topic area. Make sure you have a specific example where you made an impact. The other thing is, don't just make it up, because you need to recall details. So if you just make up an example for the interview and they start asking you questions, it's very difficult to recall if it's not a real scenario. So don't make the example up is really important. Prior to interview, it's helpful to prepare some examples from your current role or previous role in case you're asked to talk through an example. And sometimes in a question, it's helpful to give an example to demonstrate. So you could say, for example, this happened. So I would say it's very helpful to prepare an evidence-based practice example where you've provided evidence-based care, where you've provided quality standards or you've improved the quality in a situation or in a service, or how you utilise current research in your role. A question could be posed, how do you keep up to date in your practice? So think about how your practice is evidence-based, informed by current standards and regulations. If it's a question linked to quality improvement or service evaluation or risk management, decreasing risk to patient, you're going to improve quality. It could be, give me an example of how you maintain quality in your role, or how you provide quality care for your patients or to staff or to a service. Again, it depends if it's a leadership role. Early career nurse, it would be more about how you provide quality care to your patients, or decrease safety risks across a service. And you will have those examples. As a student nurse, think about your assignments you've written. You know, putting a pair of TED stockings on is ensuring safety. Anti-embolized stockings, for example, is ensuring safety. Encouraging somebody to eat or to drink. It's nothing, it doesn't have to be something really complex for quality improvement or decreasing safety risks or risks to a patient. It will be due to link to quality care plan, something in your quality care plan, for example. So it's really good to prepare those examples. Think about good examples for teamwork as well, and how you've developed, how you've demonstrated teamwork or collaborative practice, and leadership or organisation or managing your care, and education and health promotion, or dealing with a challenging situation that you overcame and learnt from, because we're always learning as nurses. So we've looked at all our preparation. Now we'll start with some example questions. None of these questions may come up, but usually you will have a question on why you've applied for this role, this emergency nurse role. What's attracted you to the role? What led you to apply to this service or to us as an employer? So all the previous tips I gave you relating to your background preparation are going to help you. They might just say, tell me about what you know about this emergency department or this walk-in centre or urgent treatment centre. Or they might ask you a question about them as an employer, an NHS trust, or about the community setting or service. It depends what type of role it is. So you should have reviewed the employer website, know about their values, what's going on in the service, and you might have already booked an informal visit. And this is where an informal visit or a telephone call, talking to people in the role, can really help. If you can't manage to do an informal visit, have a look online on NHS career websites, Department of Health website. There are videos of people talking about emergency care and their role. Another typical question, what key skills have you got required for this role? What key skills or values does this role require? Why should we offer you this opportunity above other candidates? So you need to know the key responsibilities in the role to answer those questions. So you should have looked at the job description and clarified anything that you're unsure of. When you draw out your key skills required for the role, think about your current transferable skills as a student or an early career nurse, or if you're going for a management or leadership role, and how your current transferable skills relate to the role. A big part of any emergency nurse role is an autonomous clinical assessment, recognising physical or mental deterioration, recognising and responding to emergency conditions, remaining calm. It's about sound decision making, adhering to escalation policy procedures, acting professionally, adhering to professional standards, and a massive part of the role is communication skills and team working that underpin the role. You've got all the complexities of patient-centred care, when patients and their families might be very stressed, especially if they are waiting a long time, there's delays to treatment, or somebody's deteriorating. You also need to manage your time effectively in a very fast-paced environment and be able to problem solve. You might have to conduct audits, service evaluations, lead teams as part of a leadership role, and promote compliance with statutory mandatory training, promote a positive learning environment. There's health education, health promotion there as well too. So reflect on your current skills and how they relate to the role prior to interview, so you can answer these sorts of questions. Some more generic questions you might be asked: what are your strengths? So think about how you would, because this is individualised to you, so I can't answer these questions for you, but think about how are you going to answer a question if they say, what are your current strengths? If you're offered the role, what challenges do you envisage when you first start the role? And there will always be challenges. So if you're new to an accident emergency department, you can say, that your first challenge is to get used to the area, to get orientated. But the key is saying how you're going to overcome that challenge, which would be to ask for support, to review the intranet, to educate yourself. So a classic question is, tell me about a time when you overcame a challenge or learnt from a challenge. And again, what they're wanting to know is that you're a reflective practitioner and that you will go and hunt out the information and educate yourself, develop your skills, and utilise the support that's available. How do you manage your work-life balance? What strategies do you use to manage stress? And that's a very a question that often comes up at interviews, especially in an accident and emergency department, which is fast paced and can be highly pressurized, and they need to know that you're going to be able to cope and manage and have strategies to manage stress. People can become very frustrated in A&E when they're waiting, and people can rapidly deteriorate. So you need to be able to think on your feet, to problem solve, use a structured ABCDE approach in an emergency situation. You're dealing with a range of situations in individuals who might have complex mental health conditions, antisocial personality disorders even. So the interviewer needs to know that you can deal with this sort of environment, problem solve and escalate properly, that you work in teams effectively, which is important for collaborative working, and team working is essential to manage stressful situations. Being able to recognize when you feel stress and that you've got strategies to deal with stress, that you maintain a work-life balance. You state how you're going to balance. You enjoy swimming, outside work, reading, whatever it is that helps you unwind after work. The escalation aspect to your manager and to medics is very important, and that you seek additional support if you're struggling. So it's very helpful to have knowledge of the team structures in an emergency department or an urgent treatment centre or minor injury unit, so you know how to go to, who to go to for support, what those structures are. Another classic question is, where do you see your career in 5 years' time? And again, that is going to be very individual to you, but think about it before the interview. Another key area is quality care or key performance indicators, and this is typical for senior positions, band sixes and above. But even for early career nurses, they may ask you a question on, give me an example where you made an improvement in patient care. If it's a more senior position, it might be across the service. How do you evaluate your care? Or how would you evaluate the care, the quality care in this role? If you're offered this role, how would you plan to evaluate the services across this department or urgent treatment centre or minor injury unit if it's more of a senior position? What are the current national targets for this accident and emergency department, or do you know one of the targets? And the interviewers wanting to know that you understand concepts of quality care or quality improvement or service evaluations. But as I said, questions will depend on the role. So reading about quality improvement is helpful. Some of the answers to these questions aren't necessarily complex, but you can go blank if you're asked, how do you evaluate quality care? Or how do you evaluate the quality of your care? Or how do you utilise evidence base in your role? So the best way to evaluate care is to talk to a patient, but you can go blank, and people don't always answer those sort of questions because they just go completely blank when they're asked such a question. Evaluating quality care is about gaining feedback from patients, observing improvements in a patient's condition. You're evaluating care as part of your care plan, as part of the nursing process. We also use patient and staff surveys to assess and monitor quality care across the service. We can look at clinical outcomes, either individually, a wound, somebody with a broken arm, it's all strapped up. It depends on what the patient's coming in for, the person's coming into accident emergency for. But we can look at clinical outcomes across the service generally, mortality rates, decreasing waiting times, and a patient's condition generally improving through urgent care diagnosis, treatment or referral. Clinicians can compare data, and there's also daily, weekly reporting across emergency urgent services, and we review those improvements and decreases in patient flow across services if it's a leadership position. We use audits to evaluate care, we monitor service standards, and we learn from audits to improve service delivery. We can also review clinical incidents, number of complaints to assess quality in a service too. So think about some examples where you've made an impact to quality care or to a service prior to your interview, and review those sort of terms that might come up as well. If you're preparing for a more senior position, a team leader role or a management role, I've got videos on how to prepare for those sort of interviews, developing leadership skills, quality improvement, teamwork, also dealing with conflict and incivility or coordinating nursing care. If your role links to promoting the flow across monitoring the flow across accident and emergency departments, for example. So you might find some of those videos helpful. They're all free on my YouTube channel. Some questions relating to education might come up as a nurse interview. So any registered nurse, early career nurse, will be educating patients before they go home, for example, with patient information, leaflets, or for follow-up and referrals, right up to leaders who will be promoting compliance with statutory mandatory training, for example. So education usually is in some way part of that job description. Typical question that you might be asked is how you keep yourself up to date with research or the latest evidence. Where do you find the latest emergency care evidence-based information, target, standards? So think about emergency care. As I said earlier, I've given you lots of tips for different current key targets, for example, current waiting times, reviewing current standards, and I signposted where you might find some of those on previous slides. They might ask you to talk about a recent article or research study in emergency care and why you find it interesting. So again, I talked about that earlier. Could you give me an example where you previously educated or supported a patient or a staff member? How did this teaching support impact on them, or what difference did that support or education make? Another classic question is, what would your key objectives be in the first 3 months if you were offered the role? So you need to know what an objective is as opposed to an aim, so it's measurable, to answer that type of question. For a more senior position, you might be asked, how would you ensure the learning needs of your team are met? How would you promote compliance with statutory mandatory training? Or it could be compliance with appraisals, for example, because a lot of NHS trusts need to have compliance with appraisals. It's monitored nationally. So how would you promote a positive learning environment across the service? So a few education type questions there for you to consider prior to interview. Then you might have some scenario-based questions. What would you do if X, Y, Z happened? Now, I've presented a few example scenario questions in some popular areas. Obviously, these areas might not come up, but what's very helpful is to do the preparation that I suggested and signposted earlier, because you'll be reading around the area. So as a subject comes up, it may be a different question, but because you've done some reading, you could potentially say that, you would look in a signpost and look at NICE guidelines or the Cochrane Centre standards and guidelines, or you would look on NHS websites, so you know where to look for the information, for example. But typically interviewers are going to ask some scenarios that assess your problem-solving skills. They're looking to see that you're systematic. They're going to be assessing your clinical assessment skills and organisation or managerial skills. So an example might be, I'll give an example here. A drunk person arrives in A&E and their friend states that when they fell, they were standing on a table in a pub and they hit their head. They didn't knock themselves unconscious at the time, but they've now been vomiting for over the last hour. Over the last 10 minutes, they're starting to become sleepy. How would you manage this situation? Or they might say, what would you prioritise first? Or how would you triage this patient? So I'm not going to answer these questions for you. And it's really important not to learn questions completely off by heart. Think about bullet pointing and just systematically in your head practice answering such questions. But it's important to read around the area. So read around your ABCDE assessment is going to help you for a vast amount of questions that involve a clinical assessment, for example. And in this area, you can see that this question, you're going to need to adhere to current evidence. There is current NICE guidelines for head injury and early management that you could say you would refer to the current guidance. You should always use an ABCD approach. They would need to immediately do vital signs and a Glasgow Coma Scale assessment because it's a head injury. So you'll be assessing a conscious level here, and you want to know what their baseline conscious level is to monitor closely for further deterioration. This person's going to be at risk of brain swelling and increased intracranial pressure. We don't know what's going on inside their head. Is it the effects of the alcohol as to why they've gone sleepy, or is it the effect of intracranial pressure? And we can never presume. So they would have to be escalated to a medic for a CT, MRI, diagnose any fracture, skull fracture, brain swelling and intracranial pressure, take bloods, etc. But the escalation pathway, so reviewing your escalation pathway is very helpful as to who you escalate to, your triage scales as well, your triage tools as well. And monitoring patients' condition closely is paramount in this situation. So think about how you would answer such a question. Other scenarios might be similar, linked to signs of sepsis. So if someone's coming in with signs of sepsis. So similarly, using a systematic approach, adhering to current evidence, we have an NHS sepsis 6 pathway currently. That may change, but what is the current escalation pathway for sepsis? Where we take immediate action, patient high flow oxygen, blood cultures, etc., IVs, antibiotics, fluids. I'm not going to give you the answer. Again, you need to think about looking up what some of these pathways are. And again, something similar might be hypoglycemia or hyperglycemia. So scenario-based questions may link to clinical assessment. A scenario given may not just be a physical based scenario. You've got to think of the whole person-centered approach, and mental assessment, capacity assessment may be needed. So I've just given an example here. A 24-year-old's currently homeless. They've been treated in accident emergency for an overdose of opiates. Following treatment, this person's now physically stable. However, the medical consultant has requested that the psychiatric team assess them as a matter of urgency. The individual admitted that they've not been taking their medication for schizophrenia for weeks, and they've been experiencing dark hallucinations. You find them trying to walk out of accident emergency department. They state they want to go, they don't want to meet the psychiatrist, so what are you going to do? Again, I'm not going to answer this question, but a typical question would be somebody trying to self-discharge. They don't want to wait for the treatment. So what are you going to do? It's helpful to look at self-discharge procedures prior to your interview, because you could be asked anything to do with self-discharge. Escalation to medic, senior nurse team. The importance of recording conversations with self-discharge. What was said? What did you do? Explaining the situation to this person. What strategies are you going to try to do? Because your aim is to try to keep them there for their own safety, to get them assessed before they just discharge themselves, because the medic has prescribed an urgent psychiatric referral. Initially, your aim is to try and get them to stay. But this example also has the additional complexities because it's going to involve medical capacity assessment. Does this person have the capacity to make the decision at this time to self-discharge, or is that dangerous? Are they a danger to themselves and to others? So it's about safeguarding that individual. If a person has mental capacity, you can't detain them in an accident and emergency department, whereas if they don't, you can. So this is a safeguarding issue if the person is at risk. So reading around that, and you can discuss it tentatively as in your answer, but you need to take swift action, escalate to seniors, fast bleep the medic, and this medic may already have assessed, they might have done a mental capacity assessment already, it could be recorded, and if you were worried about them, the doctor was worried about them in the first place, he may have already conducted a mental capacity assessment. But it's key to know what a mental capacity assessment is, how it links to the Mental Capacity Act and legislation, because you could be asked a question on this at interview. So reflect on how you would answer this type of question and read around the subject area. So if you were asked something similar or a different question on self-discharge, you know about it, or if you're asked a question on mental capacity assessment, they could just ask you, what is a mental capacity assessment? How would you conduct a mental capacity assessment as part of an interview as well? Often in emergency care interviews, you're asked scenario-based questions linked to communication. It could be a complaint, it could be dealing with abusive behaviour or incivility, or it could just be someone really agitated due to being delayed. There's delayed waiting time. So I've given some examples. These might not come up, but reading around the areas will help you answer any such question. So I've given an example. Following triage, an individual is waiting to be seen by a doctor for a potential fractured ankle following a local football match. They've been waiting quietly for 1 hour, but they've started to become very agitated and verbally abusive to the receptionist and other people in the waiting area. How would you manage this situation? So again, signposting for you, I'm not going to answer, but reading around de-escalation, dealing with incivility will help you. Dealing with a complaint, reviewing complaints procedure before an interview. In any situation, you need to look at the whole picture. Think about the person from their perspective initially. Do they need, for example, does this person need analgesics? Are they in severe pain now or missing other medications? So finding that out might resolve the situation. Try to be calm, professional, listening to what the person's complaint is, and explain the reasons for the waiting time. There are others who require urgent assessment, maybe enough to calm this situation down. But you're going to need to balance it with the fact that it's unacceptable behaviour to abuse staff. It won't be tolerated. And lots of accident and emergency departments now and urgent care treatment centres have zero tolerance for abusive behaviour. The person, you could warn the person that if it carries on, they may be removed by security if it continues. But you're gauging the situation. So initially trying to calm the situation, find out what the reasons are, and you might de-escalate very quickly. But if it's starting to escalate, they're not adhering to what you're saying, they're not calming down, they're continuing with their behaviour, then you may call security. You might have to call security. If you warn them, you might have to call them. If it looks like they're going to get physically angry, calling security earlier as well is because you're trying to protect your staff and other people in that accident and emergency department. So you could also have a question linked to patient incivility, but also linked to staff conflict. So an example here is a team member informs you that another team member's always being rude to them. They feel that they're being bullied whenever they work in the same clinic. What would you do? So even if you're an early career nurse, if somebody comes to you, you're needing to be supportive and think about how you can support them. Helpful to review the bullying and harassment policy that might help you. Again, you need to actively listen, treat them kindly, compassionately, and help signpost them to seek support and advice. And we've got lots of ways to do that. Talking to your manager if they don't feel comfortable, freedom to speak up guardian or human resources, or even a union representative. But have a read around that sort of question, how you think about how you would answer it. If you are in a leadership position, you might need to resolve incivility or conflict between two staff members in your team. So then refusing to work together, for example. So again, reading around de-escalation, resolving conflict in the workplace. I've got free videos on my YouTube channel, again, about team working, that I've got strategies to promote good team working, positive team working, collaborative practice, and also how to deal with conflict and incivility. I have a free video on my YouTube channel, again, with lots of strategies that you could use in any sort of scenario, really. A few more topic areas you might want to read around, but obviously some of these might not come up, but they are general areas. Are managing a complaint. So a patient's relative approaches you to say they want to make an official complaint about a support worker who's been rude to them in a clinic room. How would you manage this situation? Reading around prioritising care or a caseload. So an example question: what strategies do you use to prioritise care across your patient caseload? How do you prioritise care when two patients are calling for you at the same time? I've got a video on delegating care that might help you there, and links to prioritising care as well, looking at your how you prioritise care. Triage tools are also good to look at in that situation. Also, you might be asked questions linked to NMC code, confidentiality, or general data protection regulation. It's helpful to review regulation and NMC professional standards. So an example might be you overhear a receptionist talking to another receptionist about one of the attendees in an urgent treatment centre. The receptionist disclosing health-related information. What would you do? So you need to know about what the confidentiality regulations are and GDPR regulations are, but also how would you manage that situation? Questions on safeguarding or equality and diversity. So a person turns up at accident emergency with bruises and burns on their arm that look like cigarette burns. English isn't their first language, but their partner's adamant they can interpret for them. What do you do? So we always ensure that we have registered interpreters. A partner wouldn't translate for them because there's potentially signs of abuse, cigarette burns here. So escalating to medics, looking at your safeguarding procedures and escalating to safeguarding leads for a review. As I said, I'm not going to answer these questions, but just signposting where you'd look for information and some of the sort of areas that might come up. So safeguarding policies and reporting abuse. So I hope you found some of these questions helpful. It's also important to talk about what do you do if you're not offered this role. It can be really disappointing and disheartening, but it's paramount that you try and learn from every interview that you go to. Use it as a learning experience, and I promise you your interviewing techniques will get better and improve. I went for 3 interviews for my first team leader role, and my first one was horrendous, second got better, and third I didn't think I'd got it, but I had. But with every interview, I learned from the feedback. Always request verbal feedback, even if at the time you don't feel like asking for it. If they don't give you that feedback or you just get an email, you should get verbal feedback, but put a request in writing and email the HR team or the line manager and ask for feedback. And ask them which were my weaker answers, which were my stronger answers, where could I have improved my answers, which areas do you think I need to work on, whatever questions you think you feel comfortable asking, but that will give you such important information to help you improve. It may just be that people that applied were more experienced than you and they had hundreds of applications this time. So don't give up on applying. And also, if you're showing willing and you can say, could I apply for future roles? They'll remember you. They'll know that you came back, you're trying again, and you're trying to improve your interview technique. Reflect on the interview feedback then, and that will inform your interview preparation. And also it's helpful to write down those interview questions sometimes whilst you remember them. They may come up again or they might be slightly different, but the similar areas may come up. Also, if you really feel that your technique at interview, you've been for a few interviews, is poor, that you're just not getting there, try to book somebody to do a mock interview with you to give you some feedback, or attend interview workshops and staff development days that will offer interview tips. I've also got my book, How to Prepare for Interviews and Develop Your Career for Nurses and Midwives, right from early career right up to senior positions. So there's lots of helpful tips, personal statements and example questions in there that might help you as well. And you can get that in the library as well if you don't want to buy it. So good luck with your interviews. Keep my fingers crossed. Let me know how you get on in the comments in your interviews. If you have any questions at all, put them in the YouTube comments. But also I'm aware some people prefer to DM me privately. So you can DM me on Twitter and I'll get back to you privately if you've got any specific questions. And I wish you every success in your future careers.